Hello, friends. Welcome back to my YouTube channel, Health Matters with Dr. Shritama Banerjee. Today, I'm back again with another new video. This time, it is regarding lifestyle modifications to reduce blood pressure. So, what is the definition of blood pressure? According to the American Heart Association and the American College of Cardiology guidelines, hypertension or high blood pressure is defined as the systolic BP greater than 130 and the diastolic BP greater than 80. So we call it high blood pressure or hypertension if either of these, that is, if either the systolic BP is greater than 130 or if the diastolic BP is greater than 80 or if the combined blood pressure is greater than equal to 130 by 80. So, this is the definition of hypertension or high blood pressure. So, if the BP has been raised modestly, that is, there is moderate increase in the BP, then lifestyle modifications will be enough. That is, you will not need to take medicines. You will not need to take medicines to reduce your blood pressure. Only lifestyle modifications will help you to correct your blood pressure and decrease your BP, provided your BP is only modestly raised, not much, not very high BP. So, coming to the first lifestyle modification, you have to decrease the intake of sodium. So, what is the major source of sodium in our body? It is common salt, sodium chloride, table salt. So, we have to decrease the amount of salt that we take in our diet. The guidelines say that only we need salt, some amount of salt is required for our normal health, but that is only as little as 500 milligram. And the maximum amount of salt that is permissible for a normal human being with hypertension is 2300 milligrams. So, the salt intake has to be such that the sodium level remains less than 2300 milligram, and that has been measured that about 1 teaspoon of salt will give you the required amount of salt, that is less than um 2300 milligram of sodium will be obtained by taking maximum amount, that is 1 teaspoon of salt. You cannot have more than that. So, what we as doctors tell our patients of hypertension that don't take extra salt over and above what amount of salt you have already used for cooking the foods. So, certain amount of salt is added to the food while being cooked for giving it a normal good taste. Over and above that, don't take any extra salt in your platter, in your plate. Just that amount of salt which has been used for cooking is adequate. And coming to the next modification, you have to lose weight. And for that, you have to do adequate physical activity, adequate physical exercise. What we normally suggest is that you have to do physical exercise for at least 30 minutes per day for at least 5 days a week. This is the bare minimum. If you do more than this, it is absolutely it is recommended. However, at least this much you have to do. 5 days a week, 30 minutes each day. 30 minutes each day for 5 days a week. That is the bare minimum that is required to maintain health. And in those who are accustomed to taking alcohol, uh, I would suggest stop taking alcohol. But initially, at least you have to drink in moderation. That is, uh, for males, you have to keep your alcohol ethanol amount to less than 40 grams per day, and in females, less than 20 gram per day is the maximum permissible limit. It is better if you stop drinking altogether, but at least you have to maintain this rule and regulation. And also, another natural method to decrease your BP is taking beetroot juice. Uh, Beetroot juice is very good for lowering your BP, and you will be benefited if you take that. And so this is all for today's video, and wishing you all a very happy and healthy future. And I shall be back again with my next video. Till then, bye bye and stay safe.